Hey girl gang, it's Dr. Joy here and you are watching Delivering Joy MD TV. Welcome to Well Woman Wednesdays. We are continuing our discussion on sexually transmitted infections today. And today we're learning all about gonorrhea. Gonorrhea is one of the bacterial sexual transmitted infections. So stay tuned to get the details. All right, girl gang. So gonorrhea is a particular bacteria called Neisseria gonorrhea is the full name for it. We pretty much call it GC for short. So gonorrhea can cause a bacterial infection in both men and women, and it's transmitted by sex. So that could be oral sex, vaginal sex, or anal sex. This infection can affect the mouth and throat, the vagina and other female reproductive organs, the penis and other male reproductive organs, as well as the rectum. So why is it important to know about gonorrhea? Well, gonorrhea can lead to several serious health conditions. So since this is all about the girl gang, I'm gonna focus specifically on women. So gonorrhea can infect the vagina, the cervix, the uterus, the fallopian tubes, and even the ovaries if the infection is untreated. So it's very important for folks to be treated. In 2018, the CDC analyzed sexually transmitted infection data for the United States and found that about 1.6 million cases of gonorrhea occurred in that year alone. More than half of those cases occurred in young people, age 15 to 24. So I think about gonorrhea in terms of how it can affect your long-term health. And when you have a gonorrheal infection, this infection can really cause some problems in terms of the female reproductive organs. So if this infection is left untreated, not only can it cause a vaginal discharge or pelvic pain, but it can also lead to what's called pelvic inflammatory disease. Pelvic inflammatory disease can become so severe that you can develop an abscess on your ovaries, your tubes, or even in your uterus. And those severe cases of pelvic inflammatory disease can lead to infertility and even need for hysterectomy. Some of the symptoms of gonorrhea infection include abnormal discharge, like a yellow, green, or brown discharge. Also, bleeding in between periods or spotting can occur with gonorrhea. Pelvic pain is another big one, and burning with urination. There can also be rectal infection if you're having anal sex, and this can lead to discharge from the anus or even bleeding from the anus. An important thing to note about gonorrhea is that being infected with gonorrhea can increase your risks of actually contracting HIV. And if you are pregnant and have gonorrhea, you can pass this infection to the baby as it's coming through the birth canal. And gonorrhea in babies leads to blindness, can lead to a severe blood infection called sepsis, and can also cause joint infections in babies. We can test for gonorrhea by using a simple vaginal swab or a urine sample, and these are sent to the lab and resulted. If we have a high index of suspicion that you may have gonorrhea or one of the other bacterial STDs, we can always treat empirically, which means treating before we actually have the result. And so there's really not harm in that, and you can be treated if there is a high degree of suspicion that you may have a serious infection like pelvic inflammatory disease. The treatment for gonorrhea is actually antibiotics. That one single dose of injectable antibiotics should cure the infection. It's very important if you've been diagnosed with gonorrhea that your partner also be tested and treated, and that you guys abstain from sexual intercourse until both of you have a negative test. We have seen gonorrhea infections that are resistant to the normal antibiotic regimens, and that's why a test of cure or getting retested to make sure you're negative is really important. So here we go. Prevention. How to prevent gonorrhea. You know I've said it about 12 times during this series, but I'm gonna say it again. Monogamy. Being monogamous and exclusive with one partner is the best way to avoid sexually transmitted infections. And that means you gotta be monogamous and your partner has to be monogamous. And that really helps cut down on the spread of infection. We wanna share love, we don't wanna spread disease. Also, of course, Proper use of condoms or barrier methods can help prevent infection as well. If you are concerned that you may have a sexually transmitted infection, see your doctor right away. And also keep check on your status. If you are not in a committed relationship, definitely get tested at least every 6 months. And if you are in a committed relationship, at least once a year, especially if you are under the age of 25. I think that's very important because we want to try to keep gonorrhea from impacting your future fertility and your health. I hope you found this video useful. If you did, give it a thumbs up. Make sure you subscribe so you don't miss a single episode of Well Woman Wednesday. And we'll be back next week, girl gang. Peace.